This recorded lecture will go over information from Chapter 2 and Chapter 3. So we're going to start with Chapter 2, which we're going to focus on therapeutic communication. It starts on page 26 of your textbook. So what is therapeutic communication? Therapeutic communication is purposeful, goal-directed, and focused. Therapeutic communication requires conscious effort and considerable practice. It requires that the nurse be present. Presence is a holistic model of communication where the nurse connects with the patients within an atmosphere of compassion and being in the moment. When the nurse is truly present, the nurse is mindful of the patient's and family's needs and takes the time to listen, empathize, and be with them. Therapeutic communication requires flexibility and cannot depend on a particular set of learned techniques. However, certain guidelines may be helpful. And the guidelines are listed there. The first one is a calm setting that reduces distractions and minimizes interruptions and allows for privacy. Next, interactions should begin with introductions and clarification of the nurse's role. The introduction describes the nurse's purpose and sets the stage for a discussion of the patient's concerns about what happens when the family is discharged from the hospital. Next, therapeutic communication should focus on meeting the needs expressed by the family. Beginning the interaction with an open-ended question such as, "How do you feel about going home with your baby today?" is one method of focusing the interaction. Redirecting the conversation may also be necessary. Sometimes when you're talking with the patient, they get off track, right? And you have your own goal that you're in there to achieve with the patient. So redirecting, the example in the book says, "Thanks for showing me the beautiful pictures of the baby. I understand you're having a bit of trouble getting him to nurse," right? So you acknowledge what they're talking about, but then you redirect to get back on track for whatever it is your goal is. Next, nonverbal behaviors may communicate more powerful messages to the patient than the spoken word. So think about nonverbal behaviors that would be off-putting to the patient or to the caregiver. So things such as tapping your foot like you're rushed and have somewhere else to be, checking your watch, maybe looking at a work phone or paperwork about work, something not involving them, right? Just showing that your mind's somewhere else. Standing with your arms crossed, right? Maybe even the way you're holding your face, whether your brows are furrowed, things like that. So nonverbal behaviors that could encourage communication. Think about some of that. What might be a nonverbal behavior that would encourage communication? And so the things we usually think of there are the open posture, right? If you have 6 patients on the floor, your patient should never feel, when you're in a room, they should never feel like they're not your priority, right? So the goal is to present yourself in a way that they feel that they are your one and only concern. So leaning in when you're talking to them. The next one we got a lot of active listening things we're going to talk about. So let's go there and see what we have. Active listening, eye contact, which signals readiness to interact. A relaxed posture with the body inclined towards the person. It shows that you're interested in what they're saying. Encouraging cues such as nodding your head, saying go on, letting them know that you're following them and engaged in what they're saying. Touch can be a powerful response when words would break a mood or fail to convey the depth of feeling experienced between the patient or the caregiver and the nurse. Cultural differences influence communication. In some cultures, such as Chinese and Southeast Asians, prolonged eye contact is considered confrontational. People from the Middle East or Native American cultures are sometimes uncomfortable with touch and would be disturbed by unsolicited touch. So we have to know, based on what the patient's culture is, what they are comfortable with. Some things not listed there include clarifying communication. It's a process of the listener receiving the message as the sender intended. If the meaning of the statement is unclear, it may be necessary for the nurse to ask questions. For example, the nurse might say, "I'm not sure I understand," or they might rephrase what they're saying. So what you're saying is, right? Finally, emotions are a part of communication, and nurses must often reflect feelings that are expressed verbally and non-verbally. The nurse might say to a mother, "You look forward to the delivery at the birth center and you're disappointed that you need a cesarean birth." And you can relate it to caregiver patients of pediatric patients. You were hoping to be discharged tomorrow, and you're disappointed that it looks like you're going to have to, that your son's going to have to stay an extra day or two for treatment. So just recognizing the emotions that are involved with hospitalization or maybe a diagnosis that's troubling is important for therapeutic communication. Therapeutic communication involves responding as well as listening, and nurses must learn to use responses that facilitate rather than block communication. The facilitative responses, often called communication techniques, focus on both the content of the message and the feeling that accompanies the message. Communication techniques include clarifying, reflecting, being silent, questioning, and directing. You can see examples of those techniques on box 2.2, page 28. The critical thinking process begins when a nurse realizes that it is not enough to accumulate a fund of knowledge from texts and lectures. Nurses must be able to apply the knowledge to specific clinical situations and thus to reach conclusions that provide the most effective care in each situation. A series of steps may help clarify how critical thinking is learned. The steps are called the ABCDEs of critical thinking. The A stands for assumptions. Assumptions are ideas, beliefs, or values that are taken for granted. Assumptions may lead to unexamined thoughts, unsound actions, or stereotyping. As we talk about the ABCDEs of critical thinking, go ahead and, after we give a definition, pause the video and try to think of an example of how you might see it played out in nursing. So for example, assumptions. So you might be caring for a patient who's been a diabetic for decades and he or she's non-compliant. So you just assume that they don't care. They don't care about their own health. They don't care about any complication that's going to come of it. They don't care about the burden they're putting on the healthcare system because they're not taking their meds like they're supposed to. But with therapeutic communication and good listening, sometimes you can get to the root of problems that aren't at all what you think. You assume the patient is not compliant because they just don't care about their own health. But when you use therapeutic communication as to why they're not controlling their blood sugar properly, things of that sort, you might find out that maybe it's a financial reason with problems with getting healthy foods or getting their medications. Or, they have other social economic issues going on that's affecting how they're caring for themselves. So we need to recognize those assumptions and then really use therapeutic communication to get to the bottom of any problems that we're seeing in a nursing situation and make sure that we're delivering good care for our patients. The second one is examining biases. Biases are prejudices that sway an individual towards a particular conclusion or course of action on the basis of personal theories or stereotypes. Biases are based on unexamined beliefs, and many are widespread. So with bias, sometimes it's an unconscious thing. So we're not even as nurses conscious of the fact that we have these biases. So that's why it's important to really self-evaluate and self-examine your own beliefs. Because with these bias, it doesn't mean that you're a bad person or that you shouldn't be a nurse, you shouldn't be caring for people. It just means that you need to recognize these so that you can understand that you might have certain feelings about certain populations, the appearance of certain patients, mannerisms you might see, and that you need to address these and deal with them in order to provide quality care for your patients. In the clinical setting, when caring for patients, you might ask yourself if you hold back certain levels of compassion for patients who are more short-tempered, if you assume low standards for a disheveled, unkept patient, right? You have different standards for different patients based on their appearance. If someone's race affects you when you see them, so you walk into a room and see a patient of a different race. So those are questions that you want to be asking yourself and recognizing, because those biases can lead to disparities in care. So every patient deserves your full best care. So understanding what might trigger you to act different will make you a better nurse in the long run. The C stands for closure, analyzing the need for closure. Many people look for immediate answers and experience anxiety until a solution is found for any problem. They have little tolerance for doubt or uncertainty, sometimes called ambiguity. As a result, they feel pressure to come to a decision or to reach closure as early as possible. The D stands for data, managing data. Expertise in collecting, organizing, and analyzing data involves developing an attitude of inquiry and learning to live with questions. It goes on to talk about collecting data. To obtain complete data, one must develop skill in verbal communication. Ask those golden, open-ended questions to elicit more information than asking those yes or no type questions. Next, validating data. Information that is unclear or incomplete should be validated. This process may involve rechecking physical signs, collecting additional information, or determining whether a perception is accurate. So that may be when you use the clarification. So I'm confused about what you said. Could you please explain it? Or are you saying that? And you repeat back what it is that you're taking away from the conversation. Next, you have organizing and analyzing data. Data are more useful when organized into patterns or clusters. The first step is to separate data that are relevant from data that is interesting but not relevant to the current situation. The next step is to compare one data with the expected norms to determine what is within the expected range or normal and what is not. The E stands for evaluating. Looks like we got the emotions and environmental factors, but it's for evaluating other factors. Various emotions and environmental factors can influence critical thinking, such as the hectic pace of the clinical area, time limitations, distractions, or fatigue that reduces one's ability to concentrate at the end of a 12-hour shift. I want you to, again, review box 2.2, which we've already talked about, and then also box 2.1. And that just talks about some behaviors that block communication. So for instance, conveying lack of interest might be with the nurse looking away or fidgeting. And then it goes on to provide the alternative. So attending behaviors such as eye contact, nodding. So go ahead and look through those behaviors, look for examples of what you might see. And before you look at the alternative on the right, try to think for yourself, what might I do? What would be the opposite? What would be something that would help enhance communication, sort of the opposite of what I'm seeing with these behaviors that are blocking communication. And while we're talking about communication, I'm just going to throw in really quick that's important that we think about the words we're using when talking with our pediatric patients. So I have some examples here of different terms or phrases that we might use in the clinical setting. How might you rephrase these possibly ambiguous phrases so that the child will understand what you mean? So for instance, stool collection. So most minors are not going to understand when you say stool, you're talking about BM. They probably won't know what BM is, right? They're going to use the word poop or whatever it is that they use at home. What about the doctor will put you to sleep? Now, if you say that to an 8-year-old who just had his cat put to sleep, he's going to think that the doctor is going to make him dead, right? So how could you reword these phrases to make it so that a pediatric patient will understand what you're saying and will understand it, or it'll be presented in a way that doesn't scare them? So take note of that on your own, and we will revisit that. So now we're going to move on to chapter 3, the childbearing and child rearing family. We're going to focus on cultural influences. It starts on page 38. So I'm not going to read them to you, but I want you to know the difference between culture and ethnicity, the definition of ethnocentrism that is there, understanding the figure 3.3, and how culture is composed of rather visible and invisible layers. And to comprehend culture behavior fully, one must seek knowledge of the hidden beliefs that behaviors express, and also that nurses must first understand their own culture and recognize their own biases before beginning to acquire the knowledge and understanding of others. On your own, I'm going to ask that you review table 3.1 on page 39. I have listed here the specific religions that I want you to be familiar with. And when you read over them, I want you to focus on how it would affect nursing care for a patient if that is the religion they follow. And finally, for chapter 3, you should have read about the specific cultural groups. And I've listed the cultural groups here that I want you to be familiar with and have outlined some of the points that you need to know for each group. So again, that'll be on your own. focusing on those, whether you use flashcards or whatever method to get those down.